Welcome to Supplement of the Week. Today we're going to talk about vitamin D. So let's get into it, starting with a little summary about what it is and what it does. So vitamin D is also known as calcitriol, and it actually kind of acts more as a hormone than a vitamin. In fact, most of our tissues have vitamin D receptors on them. Its primary roles are regulation of calcium and phosphorus absorption, regulation of calcium balance throughout the body via the parathyroid gland, and stimulation of bone mineralization. It's not actually required in the diet if you get enough from the sun, but it might be harder than you think to actually get enough vitamin D from the sun. Here's a little diagram about how that works. Here is the sun emitting its UV rays, and those come down and hit our skin. And it is in the sweat glands of our skin that UV light is getting converted into what's called pre-vitamin D. When that's done, that pre-vitamin D goes into the liver, which is also the destination for any dietary vitamin D that we've eaten. From the liver, it goes to the kidney for further processing, and then the kidney spits it out into our bloodstream as the active form 1,25-OH, and then that goes to all of our tissues. Signs of deficiency. So the primary sign is usually softening of the bones. So this would be like rickets in children or osteomalacia in adults. But deficiency of vitamin D has also been associated with things like cardiovascular disease, diabetes, anemia, infections, mental health and neurological conditions, respiratory health, and skin issues. Causes of deficiency. So obviously, if vitamin D is absent from your diet, there's one big source that you're missing out on, but probably the overwhelming cause of deficiency is just leading an indoor lifestyle. So many people, this is their life. They wake up, they get in their car to go to an office or some indoor job, and then after that they get back in their car and they go home. And that's most of their days where they're indoors somewhere. Maybe on the weekend they get out for some kind of outdoor activity. But consider this, there's quite a big difference between, let's say, being at the beach where you're in your bathing suit with most of your skin exposed to direct sun in the middle of the day versus maybe going for a hike or a walk near dusk where you're fully clothed and there's not much skin exposed to the light, and the light that is there is not very direct. So we still have to consider those factors if we're looking to maintain optimal levels. So what time of day are you out there to make sure you're getting enough direct rays? How much of your skin is exposed, and of course the duration. Are you out there long enough? And usually, depending on your skin type, about 20 to 30 minutes is generally safe. Can you have an excess of vitamin D? Now, in terms of getting it from the sun, you cannot. Your body regulates that absorption of vitamin D from the sun pretty closely, so it's virtually impossible to get an excess from the sun. Now, as for supplementing, it's still really difficult to reach those toxicity levels even when supplementing. You'd have to be taking hundreds of thousands of IUs per day consistently for weeks or probably even months on end before potentially reaching that point. Plus, the cool thing is, the other fat-soluble vitamins like vitamin A and vitamin K, they all work synergistically together to kind of keep tabs on one another and make sure that none of them ever reach that toxicity point. Technically, it is possible. You could get there, and if so, you would experience what's called hypercalcemia or excess calcium. But patients that got to that point had vitamin D levels over 200. Now, to give you a reference, it's difficult for most people to get their vitamin D levels at 30, let alone 200. So chances of that happening are very, very slim. How much do we need? Conventional ranges for normal are 30 to 70. But functional medicine is always looking at what's optimal, and they would say that 60 to 80 is more optimal. Now, there are some practitioners that feel the higher the better. You should aim for the upper end of the range. You should aim for 100, but research doesn't necessarily support that. There is good research showing that 30 to 32 should be enough to suppress parathyroid function, which just means that you're not going to start leaching calcium from your own bones and you've absorbed enough. So how do you get there? How do you get your levels up to that point? Well, this is something where there's a little difference of opinion between conventional doctors and more functional medicine doctors. The conventional medical doctor tends to only prescribe 1,000 to 2,000 IUs per day. But what I found in my practice with my clients and what I see anecdotally with most of my colleagues is that is nowhere near enough to get people's levels up if they're deficient. So if you're below that 30 to 32 mark, then what I typically use is 10 to 15,000 IUs per day for maybe a couple weeks to get those levels back up. And then when they are good, about a 5,000 IU per day maintenance dose tends to work pretty well. So give that a try. Food sources. So if you're going to get it from your food, you can look at things like fatty fish, like sardines, salmon, or tuna. It's also high in egg yolks, butter, and liver. But of course, as we just discussed, the best place to get it would probably be from the sun. Fun fact time. We've covered the process of absorbing vitamin D from the sun. We've covered all those conditions that need to be present in order for you to do that. There's one thing I wanted to add there, and that is that it can take up to 48 hours for maximum absorption. So if you remember, the UV rays come and hit our skin, and then in the sweat glands, that's where the rays get converted into that pre-vitamin D. Now, before that can get into the bloodstream and make its way throughout our body, that's where it can take up to 48 hours for full absorption. So let's say you're doing all the things right, you get all those boxes checked. You're outside in the middle of the day under direct sun with most of your skin exposed for plenty of time, 20 to 30 minutes, but then you go home and you shower right away. Well, you might be washing out a lot of that vitamin D that you were trying to absorb. So I'm not going to tell you how often you should shower, but just know that it might affect some of that absorption. Which supplement to take? The cool thing about vitamin D supplements is that they're relatively inexpensive and they're pretty easy to take. So they come in either liquid or gel cap form, and if you take the gel cap, they're usually pretty small, so they're pretty easy to take. Personally, I prefer the liquid because it's super easy to just drop it right under your tongue, and the vitamin D gets absorbed very easily through those thin membranes under your tongue, goes right into your bloodstream versus having to go through digestion like the gel cap. And the product that I personally use is orthomolecular products. It has vitamin D plus K2. And the reason why I like to have both of those in the blend is because the vitamin K kind of acts like a traffic cop. So the D is helping you absorb it, and then the vitamin K is directing it where to go. So it makes sure that it goes into places that you want, like bones and teeth, and not into places that you don't want, like let's say your kidneys, where it could cause a stone. So I like this one. It's got 1,000 IUs per drop. So if you want a 5,000 IU maintenance dose, 5 drops under the tongue, and you're done. If you want 10, you want 15, whatever you want, you're also getting the K2 along with it. All right, thanks for tuning in. If you want to try that vitamin D or get access to the highest quality practitioner supplement brands, you can create a free account at orionstrength.gethealthy.store and use the practitioner code ORION when setting up that account. All right, I'll see you next time.